Yeah, good afternoon, everyone. And it gives me an immense pleasure to introduce you to Dr. Gautam, who has secured rank 607 in recently NEET PG exam. So, Gautam, how are you feeling now?
Sir, honestly, I'm feeling great that like I got a good rank on my first attempt. Honestly, I expected better, but yeah, this is also a great rank, and hopefully I'll get the subject of my choice. That is, like I was aiming for medicine and secondly pediatrics. So hopefully I'll get pediatrics in Delhi. So I'm pretty happy.
Okay, so tell me about your preparations. When did you start your preparation? In which year of MBBS?
Basically, I started in third year. So basically in third year, I aim to complete all my third year subjects and make notes for the first and second year subjects and simultaneously start on the bigger subjects like medicine, surgery, obs gynae and like completing some major units and then hopefully which would ease my burden in the final year. And then minor subjects I try to do it with my postings so that they'll be easy to revise later on. And then I started giving my grand test in my final year. And initially it was a lower score, like in the range of 120, 130, etc. But after that, like after my internship started, and then I started revising more, and then the scores started going up. And eventually, I was able to reach the scores of 170 to 180 in the range of 170 to 180. And in NEET, I got 166 correct. So like approximately in the same range. So yeah.
Okay, so that means ki you started in your third year and you started with the bigger subjects also, some of the units bigger subject,
Yes,
so
sir.
that the burden will be reduced in your final year.
Yes, sir.
Okay, fine. And you attended your classes, face-to-face classes on a regular basis.
Yes, sir. I try to attend face-to-face classes, but sometimes due to like if I had some work, I used to then attend the online lectures, and also I use the TND program of DAMS, which helped me to master the subjects. And in case like it also helped me identify my weaker topics and like give me the nuances of the subject which I missed in my lecture, so that I can make note of it in my main notes and then revise it later on.
Okay, so starting from third year till your internship, so that's a long duration. So you got saturated during some time and
Definitely, sir, because
hmm,
actually it's a long journey. Like because like when we are preparing for NEET UG, it was for 2 years. Now NEET PG, like dedicated preparation generally starts from third year or final year, or even for some people internship. So definitely it's a long journey. And with the postponement, I also felt that it is like somewhat draining because I gave my INI in May and then I was preparing for June. So when I got the news for the postponement, yeah, I was like a little bit devastated that it might affect my preparation, but I felt that it is the same for everyone. Like everyone has to go through the same phase. Like, so I just like motivated myself that like, let's keep going. And so I took some days off. Yes, definitely. And yeah, especially after a major test, if I gave or some, my, like in my MBBS final year exams, I just took like 1 week off and then started preparing. So that's how I combated some like saturation, I guess.
yeah, and you are from MEMC and MEMC internship is hectic. So how do you manage that internship with your preparation? Because this is a very commonly asked question from other students who are preparing for this thing exam. How do you manage both internship as well as preparations?
So first of all, like I feel that yes, MAMC internship is definitely hectic, but I feel that still like people can manage time, especially in some lighter postings like what you can say derma, psychiatry, radio postings, and but in major subjects also like some postings are medicine in MAMC is very hectic. Like we have longer hours, so like I started with medicine only, so I remember that I was so exhausted because, especially because we were new to the system and we didn't know anything. But as long as then we progressed to surgery, then we got to PSM. By that time, I had made a routine that in the morning I'll go for my posting, and then by afternoon or evening I'll get home. So when I was traveling back from to home, I used to just solve the MCQs or just revise the topics and not reading anything new. So to like utilize my time, and on any holidays, like any Sunday or any other national holiday which I had, I used to give grand tests so that I can productively use my time to, study as well as revise and do the MCQs. And while I'm waiting for something, like if I'm waiting for a report at the window collection, where we had our reports collected. So I used to do some MCQs so as to pass my time. So because I knew that sometimes we are exhausted and we may not be able to do some active learning, but if we are doing MCQs there, like it is a bit of passive learning, but still we are learning something and we are at least applying our knowledge. So little bit productivity here and there. So I just try to ensure that during.
Yeah, that's a very important, useful tip key while waiting for the reports at the collection window. You can utilize that time. Instead of scrolling through the Instagram reels, you can scroll through MCQs.
Yes, sir.
Yeah,
Definitely.
that's good. And how many revisions you had before your exam?
Before NEET, so before I would say then I guess approximately 2 revisions, I would say. Then I revised my whole syllabus again for NEET, and then I also looked at the weaker topics that which I had missed in INI or which I felt were like in general weak. Like I might have been able to do the question, but still I felt that it was more of a chance that I did it correctly. So I did one more revision of extensive revision, and then like had refer to the revision module so that I can easily do the syllabus in short period of time.
Okay, and in the revision, you said ki test and discussion was very useful for you,
Yes, sir.
and you did DVT also.
Yes, sir. I watched DBT. Actually, I watched DBT for some subjects because I felt that I wanted to just revise my notes, because I felt that I'm of the opinion that if you revise the notes, like same notes again and again, you'll have better retention. I don't want to like make fresh notes and then do them again, because I'll have a new set of data, so which I'll have to go through again. So I mostly refer to my main notes only. For some subjects, I use DBT where I felt that my knowledge was lacking, and then I use the DBT for supplementing my knowledge and keeping revising the topics and like revising my mistakes in the like tests and Q banks, which helped me to better my scores.
Okay, and out of all these subjects, which subject you focus upon maximum before your NEET PG exam, or all the subjects you did?
Yeah, matlab, basically for my weaker subjects like micro, I focus on micro and my anatomy, because I had read it in first and second year, and they have more content. Their content wise more exhaustive, and so I revised them more frequently and solved more Q banks and gave more TNDs of that subject, like more cycles of TND, as compared to medicine and surgery, which I had done recently, and I feel much stronger grip in medicine. So I did not like feel like giving more tests for the same, but for my weaker subjects, for my first and second year subjects, I felt that I needed more revision. So I focused more on them.
Okay, so coming to the subject of medicine, medicine is a very vast subject. So how did you manage medicine? Means ki you did Harrison, you did notes, class notes, or only TND?
So basically, first of all, because I know Harrison is a very long book, honestly, and it cannot be completed fully. But for this, first of all, I watched the videos and then made my notes, and then after that, keep revising them. And for any topic which I felt that I needed more understanding, I opened Harrison or even Davidson to supplement my understanding. And what I did was I started medicine third year. So basically I started with endocrinology, and then I did rheumatology, because I felt that they are heavy, like endocrinology is a long subject, but it is easily manageable if you are thorough with your concepts of physiology and pathology. Then because I felt I know for me CNS and CVS were slightly like on the tougher side. So I felt that I should gain some confidence first, then I will take them up. So I did these subjects in final year, and endocrinology, rheumat, and GIT. And yes, ECG, of course, I did it in third year. And then in final year, with my medicine postings, I finished up cardiology and neurology and the respiratory medicine.
Okay, so that means ki you divided the medicine topics into two groups, one which was more related to your pathology in the third year and
Yes.
more clinical topics like CVS and CNS during your final year.
Yes, sir. And because actually, because when in medicine postings, you also read most of the cases are in our wards were related to respiratory medicine, neurology, and CVS. So it also gave me a little bit of like practical knowledge as well. So it helped me to read the theory content also simultaneously pretty well. That is why I thought of doing them in final year.
Okay, and about your preparations, ki you did some group study or you did on your own? Means ki, what is more effective? What was more effective for you?
Sir, actually, I prefer self-study. So I focused on self-study only. Actually, but like I used to participate in quizzes, and like one of my quiz partners, I like used to discuss topics, but not like we not study together, just like discussing topics on like WhatsApp or like sending each other questions and like solving like questions together, but not like studying together. I actually prefer studying alone because I like just sometimes I walk around and like study in my home. So I felt that it may not be like preferable for other people to, because they might want to study in silence, and so that is why.
Okay, and how was your INICT?
Hmm. Sorry, sir.
Yeah, how was your INICT paper?
Yes, sir. So INICT paper was actually a bit challenging for me since it was just after the internship, so it did not give me much time for revision. And it was slight INICET papers generally are slightly on the tougher side as compared to NEET. So I secured a rank of 277 in INICT, and I had got 145 correct in that. Which were approximately what I was like expecting from the calls. And in I just focused on the weak topics in the between the duration of INI and NEET PG, so which definitely I think boosted my marks, and hopefully like I would get a comfortable क्या कहते हैं,
Okay,
seat in क्या कहते हैं, Delhi. Just hoping for that.
yeah. And in this NEET PG, how many questions you have attempted?
So I had attempted 194 and out of them I got 166 correct. So that gives 636
Okay.
marks.
Okay, and how was the exam? Was it easy or on a tougher side, NEET PG?
Sir, it was definitely like on the tougher side as compared to the 2024 paper, I would definitely say, because there were some tricky questions, like some tricky concepts and like just hidden hidden all except, or like just some hidden key info which clinches the diagnosis or which changes the like answer, but definitely manageable. And like I also made some silly mistakes which I could have prevented and I could have got better marks. But overall, I would say that it was slightly tougher as compared to the 2024 paper, but on par with 2023 paper, I would say. And
And time
that
was
is
not a challenge.
no, sir, time was not a challenge. And with repeated tests I gave in the form of GTs and like mock tests, it was actually not a challenge. I was easily able to complete the paper on time. Like I had a spare of 5 to 7 minutes in each section.
Okay, so finally, if we summarize your preparation planning, so can you summarize in 2, 3 points for your juniors or who are giving the exam next year, ki
Yes.
what will work best to
So
crack this
I would
exam?
like to summarize that. Yes, sir. So you should stay consistent even if like you feel that you're not able to prepare like on your best potential. Still, you should do something each and every day and regularly give the tests so that you know where you stand, and like with multiple revisions, it will definitely improve. Thirdly, I would say that focus majorly on your previous year questions and previous year topics. Whether you're giving INICET or whether you're giving NEET PG, you should do both the INICET and NEET PG previous year topics of 5 to 7 years at least, so that you are through with the basic topics which are asked, and if the questions get repeated, you are more likely to get them correct. And yeah, that's that. Like the major points which I would like to cover.
Okay, and how do you overcome that periods of saturation? Means ki what do you do when you get saturated with the syllabus?
So basically, I used to take small breaks in between, like, because if I'm preparing on a holiday, so definitely have longer periods of preparation, but definitely I'll get exhausted after reading for 1.5 to 2 hours. So I used to just take some breaks and then just exercise at home, like, or talk to my friends. And on weekends, I used to generally play badminton, and that is how I think I relieved some of my stress. And yeah.
Okay, and finally, which subjects you enjoy or which teacher motivated you in DAMS?
So definitely one of the key motivations was you, because I am also interested in medicine and pediatrics, and you were a wonderful teacher for me. And I used to really enjoy your CNS and GIT lectures. And I remember, like, I was I learned from you, which was a game changer for me. Now I have a very strong grip on ECGs. So, and secondly, Sumesh sir, definitely, like, I used to just watch his motivational videos and get inspired. And definitely he also helped me to like increase my radiology, like, concepts and marks in the main exam. So definitely you and Sumesh sir.
Uh, Great. So, one final motivation word for your juniors from your side.
Sorry sir, I could not get the
Yeah,
question due to poor network.
yeah. One motivational word or statement from your side to the future NEET aspirants, PG
Uh,
aspirants.
Okay. Just stay consistent and believe in yourself. And then you will definitely conquer the world.
Good. So, wishing you once again lots of congratulations from DAMS and DAMS family, and
Thank you so much,
we'll
sir.
see you on the other side taking medicine or PETs. Yeah. So, best wishes from our side. Yeah.
Thank you so much, sir. Really means a
Okay.
lot.
Okay.
Thank
All
you.
right. Okay.